Hi, I'm Peggy Clark with Aspen Ideas Health, and I'm delighted to be here with Andrea Wainer. Andrea is really on the front lines of Abbott's COVID response, and I'm delighted to have this opportunity to talk with you, Andrea.
Thank you, Peggy. It's a pleasure to be here with you and with Aspen. Thank you.
Wonderful. So, you're really sitting at such a critical frontline position in the COVID response. Before we get into some of the details, I wanted to just have a sense of, can you share with me a few thoughts of how you think the pandemic is really impacting healthcare over the long term?
Yes, thank you, Peggy. At Abbott, we're a global healthcare company bringing life-saving technologies to people around the world. And over the last year, you're right, we've been known for our role in fighting the pandemic. And, maybe I think of the world as COVID and pre-COVID. And so if we talk about pre-COVID, we were looking at trends in healthcare. We were watching trends in healthcare where patient care was moving in acute situations from the emergency room to urgent care, into retail, and then at home. And with these trends moving, that's when we made the investment to bring testing to those alternative care models. And then the world comes in with COVID, and we saw that trend accelerate. We saw, those trends picking up pace because it's about increasing access. We need to get more people tested when they need it and where they need it more. And then when we bring in COVID, not only did we accelerate those trends, but we saw new places of care come, even more alternative care settings. How has testing evolved? I would say it's accelerated moving into these non traditional channels and then bringing even new channels to care delivery. And consumers get used to the convenience. If we think about at the beginning of the pandemic, to get tested, people were waiting in long lines, and the test results were taking days to come back. And where we're at now that we've been able to bring more supply into the marketplace, people are expecting that they don't have to wait in lines, and they're also expecting that they get their result on the spot. And that is going to be a trend that sticks.
I really appreciate that, Andrea. And you've talked a lot about these two pivot points of access and affordability and alternative delivery centers. But tell us a little bit specifically about what you were involved in and sort of take us back to the moment when the need for testing escalated so dramatically. What was the response of Abbott, some of the innovations that you were involved in, and some of the challenges that you faced in rolling these out?
The first part is developing a test, but also developing a test is only half of it. It's about the scale and the capacity. And we've never seen anything like this where the world was needing tests. Typically, when we have an outbreak, it's a country, it's a certain part of a population affected. This is the world needing tests all at the same time. So, with each of these tests, we activated our manufacturing capacity. We expanded capacity, we built new plants. To date, we've launched 14 tests. We've distributed over 400 million tests in 2020 alone. And this took, hundreds of millions of dollars building two brand new plants. And also, just to put this into perspective in numbers, in 2019, we had distributed 18 million flu tests. Compare that to 400 million COVID tests between March and the end of the year when we didn't even plan for it at the beginning of the
But
year.
Andrea, let's say, most of the viewers and me included and everyone else, the testing was a real challenge. So how did you and how did Abbott respond to that? And what were some of the barriers that you faced that meant that most of us had a really challenging time, and still the access to tests are not what we would want them to be?
Whatever was challenged before COVID certainly broke and became very challenged during COVID. Where the system was weak, it became weaker. Where we had inequities, those inequities widened. That's why we're particularly excited about where we are now in our newest launch into COVID testing, and that is very much focused on increasing access and affordability. So we are launching right now our Binex Now over the counter test. That's a rapid test that we can produce in the millions at a much more affordable price and get it into retailers around the country so that we can increase the access and we can increase the frequency of testing to slow the transmission and get to those underserved populations. What we know is that everyone has been challenged by the pandemic, but we know not everyone equally, right? We know certain populations, particularly populations, communities of color, Indian reservations, you name it, many underserved populations have been hit hardest. So this is the Binex now is really a great tool for us to get into the communities that haven't had access to testing. Additionally, what we're able to do, with this test is also, in many cases, it's about getting it onto retail shelves so we can just increase the volume of testing. What we've also done to make places safe, for gathering is provide an ability for an authenticated pass. This is a digital pass. So as we bring this testing into certain environments, such as schools or universities, where we really want to make sure communities are safe, we can provide that additional complementary app.
So how far is that from coming to market?
We're rolling out our, the Binex Now over-the-counter test. It's going to be at retailers across the country.
Wow.
The retailers are going to be stocking the Binex Now across all of their stores because the focus of not only Abbott, but of our partners is to make sure we're getting to all, populations and increasing access. So it's about making sure that we have the intention of getting this test everywhere that there's a retail clinic. And then, if that's not enough, we'll continue to work with organizations to get to unpenetrated areas.
So what do you see in your role? You've been with Abbott for quite some time. How is this going to change the way you do your work?
Being on the front line at Abbott and seeing the need for closing the gap, with the inequities that we're seeing has really led us to lean forward more, right, in terms of access and affordability. We've recently put out some pretty bold aspiration targets for ourselves based on this and based on the experience that we've had over the last year to increase access and affordability. So what we've done is we've put an ambitious goal out there. Today, we touch 2 billion people with our technologies across the globe. And what we've said is by the end of the decade, we want to touch 3 billion. We want to touch 1 in 3 people in the planet. And that's a bold goal, but it takes us doing things differently. And it takes us starting in our development process to design products that can be done at a more cost-effective price, to design products that can work in many different type of environments and aren't so dependent on high technology. So again, we're doing this in our development process. We've done this with Binex Now, where we can show that we can bring a product at a very affordable price at scale. We've also done this with our Freestyle Libre, which is a continuous glucose monitoring device for those with diabetes. We started very early in that process to make sure we had access affordability in mind, and we were able to price that at about 70% less than other continuous glucose monitors and work with governments to get that product reimbursed. So these are, examples of what we're doing in our R&D, in our operations, and now we're going to be making sure this is in our design process.
So even in this moment of huge challenge, we see these possibilities opening up. Andrea, it's just been fascinating to talk with you. And I really appreciate that you sound so hopeful. And I think we'll all be thinking about this conversation when we pick the rapid test off the shelf at our local pharmacy and are thinking about all the hard work behind that. It's really been a delight to talk with you, Andrea, and thank you for all that you have done in this critical moment that's affected so many families.
Thank you, Peggy.